Hello, am I audible?
Yes, you are.
Okay, I will start my thing. So, hello everyone, I'm here, Dr. Samrina. So, today we are going to discuss about the community medicine. Hello everyone. Today we will be discussing about the community health. First, we will learn about what is community. Community is a group of people who share common geographical area of myself. It's like I'm a single person. I'm staying with my family. My family is in a particular flat. That flat is located in the building, and we are having many more buildings around us. So, whosoever lives in those flats within in those buildings, it form a community. As we all know that we as a human are social animals, so we have to be with each other. So when we are having specific geographical conditions, when we share common food or common water, that particular land, that particular area will be called as a specific community. Now, if we talk about the community health, it is simply the health services that is provided by a simple layman. As if we are ill, we go to the hospital, we are having nurses here, we are having doctors, we are having many equipments which can be utilized for our health service. Community health means we are having a one specific center in our vicinity, within in the community, that is going to give us all the medical aids, whatever is available in the hospital or in the clinic. Community health is also the subset of public health that is taught to and practiced by clinicians as a part of their normal duties. We are having many volunteers which are actively involved in this community health programs. Well-known example is WHO, World Health Organization. What they do, they don't, it's not possible for a single person to move around the world. So what they have done, they have make small groups in specific countries or within the country. They are having specific offices in a particular states. So like this way, if we club together, they form the community of World Health Organization. These volunteers provide primary health care to the community. Community health volunteers and community health workers work with primary care provides to facilitate entry into, exit from, and utilization of formal health system by community members. Now we know the community health. If we talk about the community medicine, this is a field of science where we have to study the health, disease in a particular group of people, those particular group of people we call as a community. Its goal is to identify the health problems and need of people who can diagnose the problems which is in the community. They can plan accordingly. When the plan for that particular disease is there, then only they will be able to implement it. And later on, they will evaluate the effectiveness of healthcare system. It's not in community medicine, it's not a single process, it's a multiple processes where first we have to identify the problem. When problem is there, for example, a patient is suffering from diabetes, we have to check how many people in our community are having diabetes. So we have to make particular arrangement for them, like we have to use diagnosis kit. By using those diagnosis kit, we will come to know whether they are in pre-diabetic zone or they are diabetic or their diabetic level is quite high. Or if we can reverse this diabetes as well, as if only this diabetes is in pre-diabetic zone. So with the help of diagnosis, we came to know what is the problem. Then what we have to do, we have to plan how we will be able to control its diabetes. When we make the food chart in that plan, then we have to implement it on a patient. When the patient is on that diet chart, then only we will be able to evaluate how how this plan is important or how this plan is effective in healthcare system. We have classification of community health system. First one is preventive health services, promotive health services, curative health services, and rehabilitative health services. So what these health services do to us? For example, if we talk about the first preventive health services, as I gave you the example of diabetes, here is another example, cancer screening. For example, if a patient is suffering from a cancer, he has to go through the, if it is possible, we are able to cure it. If we diagnose this cancer at primary stage or stage 1, or as I said, the treatment of diabetes. If a person is in pre-diabetic, it means he's not completely diabetic, he's in pre-diabetic zone. It's possible if we take preventive care, we will be able to reverse this diabetes. Even hypertension, we have to check for hypertension, we have to check what are the parameters. Is this genetic? Is this environmental? Or it's our food? So here are the 3 examples which are included in the preventive health services. Now the second one, promotive health service. How we will be able to promote our community services, which will be helpful in preventive health services. For example, we can make one day in our community, we can make one day as a health day, where we will educate our community people what to have, what not to have in food, how they will be able to plan their family. So when they are having kids, we all know that when we are kids, that time we have to proceed for vaccinations till 5, 6 years old. Even if some person or some child is born malnutrition, we have to give him particular supplements for that malnutrition. Sometimes we have heard, oh, the baby is born is having less weight. So we have to use such supplements which will increase the weight of baby, or we have to give proper diet to a mother so that she will be able to produce good quality of milk. Now the third one is curative health services. Like if we have some illness, it can be treated, it's curable. And the example is if we are having malaria, we are having dengue fever, we are having pneumonia. If it is diagnosis, then we can have medicine for that, then only we will be cured. This also comes in the community medicine. And third is the rehabilitative health service. In a specific community, we are having social workers. They work for society, for the benefit of the society. They provide us occupational therapy. For example, if we are having, I'm like old, 8 years old. I'm depressed. I need someone to whom I can talk, to whom I can share my problem, or to whom I can share my distress. So these social workers or volunteers, they will come to me, they will do chit chat to me. So I will be, even if they are younger than my age, they will be still my friends because they know the importance of social service as a volunteer. Even if I have friends, still we can go for physical therapy. For example, if I'm not able to sleep at night, so how will I improve my sleep? First of all, I have to wake up on time. Even if I have not slept on time, I make routine for this. I will wake up at 6 a.m. in the morning. Then I will have bath. Then I will have good breakfast. Then after breakfast, I will go for my work. Then I will have lunch on time. But make sure whatever you are eating should be healthy one. Should be healthy one. Then after coming from office, I will have a small snack, which it can be fruits or any homemade thing. Then I can go for exercise in the evening hour. So this all will include in your physical therapy. Even if I'm not able to improve, something is giving me distress in my soul, or I feel something disturbed inside, I can proceed for counseling also. So within this community center, we are having counselors also to whom with whom we can talk. They will give the solutions if you are having phobia of something, why it is so. Even in worst scenario, we are having like mental health problems where we have to take mental health service. So it means this much of things are in our community. Now what we have to do? We have to make strategies for action in health promotion. We have to make certain actions so that our community will be healthy. So first one is building healthy policy for public. We have to make such policies which will be beneficial for community health. Second, we have to strengthen the community resources and action for health. If someone is poor in our community, we have to provide him a resource. Then only if he is having proper healthy food, then only he can work on his health. Third is creating supportive environments for health. Within one community, we can have gym, we can have swimming pool where we can do our exercise. So this is how we are creating supportive environment for health. We can have greenery around us. So within our campus, we will not use diesel or oil cars, petroleum cars. Within our campus, we can use battery cards, which will help us to eradicate, or it will help us to use positive environment. Or else if we are using petroleum or diesel cars, it leads to the air pollution, which is not again beneficial to our health. So in short, we can create supportive environment for health benefits. We can develop some personal skills like yoga. We can sit on particular times. We will perform yoga activity. This is going to help us on at our personal level. Reorienting health system towards illness preventive and health promotion. So if we have to talk about the policy, how this policy we have to make, how it is applicable to the community health. For example, why some people, first of all, we have to diagnose the thing, right? So here is the first question, why some people are healthy and others are not? It should come to you as a medical volunteer or community volunteer. Why some people are healthy in our community and others are not? Then what is also means first question comes to our mind, why? Then we have to track the inequalities in health. For example, we are having 10 humans, 10 male and 10 female. We will see that only males are having hypertension. Why is this inequality in health, even if they are having same food? So we have to track what causes hypertension in males, not in the females. One example. Now, second, we have to improve people's health. How we will be doing? By promoting health benefits. So we have to teach them how to be healthy. This is going to improve health status of a person. Then third, we have to apply then what are different diagnoses available and how this particular disease will be treated. If a person is diabetic, what are the different medications which are available in the market for its treatment? There we can use generic or universal health care coverage. Again, this will lead to improvement in health status. As you have all aware that we recently have a pandemic, coronavirus 19. For example, forget about the pandemic. If we will talk about epidemics, we have to reduce hazards by inspecting the thing. If someone is having malaria, if someone is having cholera, what are the reasons for this? What are the reasons for this? We have to go for inspection. Do we have stagnant water anywhere? What causes this malaria in our community? Then we have to work accordingly. That's again going to improve our health status. So again, I have mentioned all points in a single chart. So first, what we have to do, we have to consider or we have to define the problem first. First is our problem. We should be able to communicate our problem with a social worker volunteer. When we are able to discuss our problem, he should be able to gather correct knowledge. He should be able to gather correct knowledge from it. Then only he will be able to see the policy of health which is existing in our community is working properly or not. If it's not so, Then he have to develop alternative. Then the volunteer have to develop alternative for your health. By selecting the best fit, it's going to give you good health. When you are in good health, you don't need to spend a lot on medication. This is how community medicine or community social workers work together. Thank you. Any questions?
Madam, can you put back the previous slide?
Pardon?
The
Okay,
previous
okay. Yes, yes,
slide.
yes, sir, yes, sir. Yeah. Mm, 1 second. Yes, sir. Anyone else? Shall I start again? Till now, everything is clear on the presentation, right?
Yeah, I think everything is clear.
Okay, thank you for confirming the things. Now we are having many, like it's not possible for a public health server or public health volunteer to work on each and every point individually. There should be some essentials which should be kept as public health service points. Like for example, I will give you some examples here. What we can do in public health service. We can monitor health status of individual community health problem. For example, if we are having one community, so what is the main problem in this community? Or we are healthy, or we are feeling sick one after another day. So we have to monitor our health status. This is the first, which should be done by these volunteers. Then second again, we have to diagnose the thing. If we are ill, why and what reason we are ill. Now we have to investigate health problems. Is something hazardous in our society, or the food which we are taking is having some problem? Then accordingly we can inform and educate our people with the health issue they are suffering from. We have to develop policies in a particular community which is going to support individual as well as community health. Like it is mandatory for a community to clean their water tank after every 6 months. So this will include in a policy. We have to make sure we have to enforce law and regulation that protect health and ensure safety. Link people to needed personal health service and assure the provision of health care when otherwise unavailable. Assure a competent public health and personal health care workforce. Then later on, we have to evaluate and quality of personal and population-based health services. Then if things are not working properly, then we have to more into our research, we have to give our water sample, blood sample to the researchers that we have done every possibility on our health. What is the problem? Then we can go for public health medicine. We are having many specialties of public health. Like in public health, we are not only talking about the medicines, it's a demography, in which area we stay. It's hot or it's cold one. The environment is humid or it's dusty. We have to see the communicable diseases. We have to check for non-communicable diseases, which will be there in the community. We have to take care of mental health of a community. Not in the mental health of community, even we have to take special care for kids. We have to educate them how to keep themselves clean. We have not only to take care of health via mental or education, we have to make sure that whatever the nutrients their community is having is appropriate. And we have to take care of our environment also. So it's not only workers who work together to form a community health, it's all together. These all factors are responsible for good health community. These all factors are responsible for. So we can say, in short, we can say one thing, 3 core public health functions are there. First is assessment, second is policy development, and third is assurance. So on these 3 functions, community work. First is assessment, develop policy, and assure that whatever we are applying is proper for that particular community. This ends up my lecture here.
Excuse madam,
Yes, sir.
are you showing a slide of that one? Because I think
Yeah, I
I
will show. I
cannot
will
see. I don't know.
show. I will show. I will show. I have not made slide. It's the verbal like outcome of the things which are in the slide. I have not prepared notes yet. In next session, I will
Oh,
give
okay.
notes for this. Yeah. Now it's not
Okay.
a complete thing. It's I have to give another note. That was just to make you things understand. I have made this presentation, and the points which I am discussing is not on the presentation. In next class, you will be getting notes of this class. Plus, I will
Okay,
discuss
noted then.
things on uploaded my in here. Microsoft Team. Please check it. This presentation is available there. Is it available? See, community medicine new. 1 PPT is there.
Okay, fine. I think we will check it after class, but as you have said it, basically the presentation are always loaded, so we believe you will load. Okay. Thank you so much.
I will make complete class notes for this topic. In next class, be on time, so we will discuss the things accordingly. So whatever queries are there, I will answer all the queries, whatever you are having. Shall I end up this meeting right now?
No, you can continue with the presentation. I was just checking to find out if you are showing a slide, but you can
Wait.
continue. We're able to take up points from what you are saying.
Okay, I will make even this notes as well for you. Can anyone tell me what are the different diseases which can be taken care by community health workers? We discussed a lot about the community health. workers. Can anyone tell me which diseases can be taken care by community health workers?
All right, thank you so much. There are a number of diseases which will be taken care by the community volunteers or health workers. The first one are the nutritional diseases.
Yeah,
So on,
nutritional requirements of the community. One.
yes,
Yes.
and
You
we
are
have
mixing the two
other.
things.
Hello.
Nutritional, yeah, you are mixing the two things together. Like nutrition is the one parameter which can be taken care by community volunteers. Then second is the disease.
Yes, I was to say that nutritional
Yes.
related
Yeah.
diseases,
Yeah.
not just
Okay,
nutrition
got
on its own.
can you discuss any disease which we discussed in this lecture? Can you give the name of that particular disease?
Yes, we have
Anyone?
cholera.
Cholera, okay, I said about the cholera. What about the diabetes? Is it possible to take care by community workers? Yes, it's possible. With the diagnosis, it's possible. For example, I am having frequent urination and I'm feeling thirsty frequently and I'm going for urination frequently. It indicates me something. So I will visit diagnostic center. I will tell them I have this type of problem. I'm facing frequent urination. So they will check my blood glucose level. They will check my blood glucose level. If it is less than 110, value may vary, okay, as per Indian standard or as per your standard value. If it is 110 till up to 110, it's okay, you are all good. Something else is there, not the diabetes. If the value of your blood sugar level is more than 120 milligram per liter, then it means something is there. Proceed another diagnosis. This was simple one test, then you can proceed further. You can proceed for HbA1c test. That test gives you the report of your blood sugar for 3 months. If it is less than 5, then it means you are not diabetic. If it is greater than 5, then it means you are in pre-diabetic zone. Till 6 value for HbA1c, we are in pre-diabetic zone. If it crosses, then it means you are completely diabetic. You are not aware that you are diabetic. In this public health community, volunteers, they can do these things. It means it's possible to reverse your diabetes. It's now new research in the market which says that diabetes is reversible. Okay, good, Adams. Thank you. Any other example? As Adam said, nutrition. Second is disease. He gave example of cholera or diabetes. Any other thing which can be taken care by these volunteers? Anyone? Mustafa, you can say anything. You can add. I will end up this meeting and next time for next session be on time and I will be providing you class notes. Okay, shall I end this meeting?
Appears the teacher is out.
So we can leave. Okay, thank you, Keith.
I
Keith,
think yeah.
but yes.
So
So
yeah.
from today's class, the last time I failed to attend this class, I don't know if it happened or not. Did it take place last week?
No. There was no
Alright,
this class last week.
better. So I was thinking that in other classes, I'm not sure they have started to create WhatsApp groups for the students themselves, because we're doing different courses, and at the end of the day, I can see that the other classes like research, you see that someone is doing public health, someone is doing another course, but because it's a common course, there it has a lot of students. While a courses like epidemiology and this one, it means we're doing specific courses which are related much to health. I was thinking of creating a WhatsApp group where we'll be discussing much more on what we have learned in class thereafter. So I wanted to hear your thoughts.
Yeah, that's a good point.
Good, good evening. Good evening, guys. This is Alfie. This is actually my first class. Um, I had issues to do with creating of a username for Microsoft Teams. So I don't know how far it's gone, but this is my first class with you guys, and I would really appreciate you could share with me how far it's gone, and I really I actually support the idea of creating a WhatsApp. Um, I should not be left out, please.
Thank you, Evis. What's your take?
I am in, actually. I am in.
All right, so if that would be the case, Keith, what course are you studying? Evis, what course are you studying as well?
That's Masters in Public Health. Obviously.
Me
What
as well,
about
I'm doing
Keith?
MPH.
Then that's
MPH.
great.
So
So can you just drop our numbers in the chat box? I'll be able to get that, then create a group.
okay, now I'm doing it now.
Good.
Yeah, so Avis, I think you don't need to be so much worried because so far this is the first class for community medicine. As MPH, I think we have got 5 courses, as you have seen in your what class timetable. So we have got on Monday we have got database management. This is the only course whereby the the doc has done about 2 slides. 2 slides. You can get one is on the first. I think the other one I'm waiting to say it because it happened yesterday. Eventually, I didn't attend it, unfortunately. So that's the only one in which we have had almost 2 classes, and the other one we have done is on research methodology. It has just been an introduction. So I think we have also downloaded the chat. We have also downloaded the slide, which if Adams create the group, we might be able to share But for the rest of the courses, community medicine, this is the first one. Epidemiology, we are yet to start, which we are hoping this week. Research skills for managers, we are also waiting to get started, which is this week. But only it was only database management we started last week. It was the only class we had. We had only an introductory slide. The other one, they have done it yesterday, but I did not attend, as I've said. And the second class I have attended is this one of community medicine. So for the rest, we are all to start new. So don't worry, you haven't delayed much.
Yeah, that's true. Even
Okay.
myself, the database management I did not attend yesterday. There's an issue to deal with the link which was being shared. I entered into the meeting and stayed for about 30 minutes without hearing anything. So I think we should be able to get that from the chat. But as Keith is saying, I think once we get things from the chat, we'll be able to share them at the WhatsApp group for the benefit of everyone as well. Yeah, thank you.
Yeah, that's a
think
good
there's-
deal. Yeah, so just kindly, again, I just want to take me through the courses that we are supposed to take. You said database management, research methodology, epidemiology, community medicine. What is other courses?
research skills for managers.
Okay, research skills for managers. Okay. What else?
How many courses do you have there? 5? Are they 5? They are 5.
Yeah, there are 5.
Sure. So
So for
you
the-
should
for
look.
this
You should. Yes, you should not. You should take note that for database management is happening on Monday. Community
Okay,
medicine
Monday.
on Tuesday. Community medicine on Tuesday.
Okay.
Epidemiology on Wednesday.
Okay.
Research skills for managers on Thursday.
Okay.
And the research
Then
methodology on Friday.
no, I thought you said the research methodology on Monday. Oh, that was for data management.
No, database management on Monday.
Okay.
Community medicine on
Okay.
Tuesday.
On Tuesday.
Epidemiology on Wednesday.
Yeah, research skills on Thursday.
Research skills for managers. Research skills for managers on Thursday. And the Friday is research
Okay.
methodology.
Okay. Thank you. I've gotten that.
Yeah, sure.
Okay. So what it means now is for the creation of a WhatsApp group, so that the notes which I've missed can be shared. Then we could get the same page.
Yeah, then we'll get in the Adams.
Yes, I'm here.
I hope you are getting the number from the groups. I think Nulu has sent his number.
Nolua, yeah, I've seen that. Nolua, yeah, got it. But I think there's another one lady I know from Marawi Branta. Maybe she has failed to attend this class. So person, I will try to reach out to her. And if you happen to know any MPH person who has issues with the classes, it will be able to share the number as well so that we can move together. Because it was happening that some were being added to the, it also happened that was given a wrong timetable. So if you know anyone, I think it would be better to be on the same track.
Yeah, sure.
All right, thank you so much.
I think when we join on the database management day, maybe we'll just share the idea.
Yeah, that's true.
Okay, fine.
Sounds
Okay,
All right,
thank
so I
you,
have.
guys.
All right, thank you.
Oh yeah, so what to be added on the WhatsApp group so we can move forward together.
Yes, I'm creating the group right now. Thank you.
Okay, thank you so much.